Right. I think that's recording. Perfect. So yeah, so this is just a video for us which is about the pelvic health Instagram live. We acknowledged that the background noise was quite a lot on that. And you may not be able to hear some of the answers. So this is just a pre-recorded video that we have done, re-asking the questions with the lovely team answering them for us. So for your benefit. So if I hand over to yourselves for you to introduce yourself.
Yeah, brilliant. Thanks for having us back on, Alex. So my name's Andrea, and I am pelvic health physio based at Worthing Hospital, and also the lead for the Wellbeing and Exercise in Pregnancy programme, otherwise known as WEP. And this is Georgia, who will introduce herself.
Hello, I'm Georgia. I'm also one of the pelvic health physios at Worthing, and I am in charge of the social media side of WEP as well.
Amazing, thank you. And I'm Alex, and I'm the NMVP site lead for St Richard's and Chichester area. So we previously did a pelvic health live, the first one that we did, and the purpose of the second one was to sort of just dive a little bit deeper into those questions to find out a little bit more information. So if I start with the first question, which was, how many people experience issues with their pelvic health?
Yeah, and that's a really good question. We get asked it a lot. Essentially break it down into bladder symptoms and bowel symptoms. So we know bladder-wise, we talk about 1 in 3 women who will experience either a range of symptoms. Can be stress incontinence, urge incontinence, and Georgia will talk more about how they present in a moment. And then if we talk about bowel symptoms, we're talking again about differentiating into sort of different subheadings. If we're talking about leakage from the back passage in terms of actually fecal material, then we're talking about 1 in 10. However, if we're talking about including wind in that criteria, and that is a big problem, especially after childbirth, and it can be really distressing, as you can imagine. So those figures are much higher if we incorporate wind into the leakage, and that's anything up to sort of 1 in 5 that we see figures from studies. So unfortunately, as we talk, we'll know that childbirth is one of the significant risk factors for both bladder and bowel leakage. We also talk about pelvic organ prolapse, and the figures for those of women who have had a child is about 50%. So the figures all in all are fairly high, and that is why we want to raise awareness and hopefully give everyone the right advice.
Definitely. As you say, that even though obviously some of the figures I've heard before, that there is such a high amount of people that it impacts. And you wouldn't think that it would be as high as that at all.
No, yeah. And then we know that these are potentially quite underreported as well, because we will have people that maybe don't seek help and advice for it, and that's really what we want to promote, isn't it?
Yeah, absolutely. And I think that's why, as I said, the studies are sort of up to 1 in 5, sometimes even 1 in 4 if we include wind. And I think because people are being more proactive in coming forwards, unfortunately, that also means that those figures have been increasing through the years with better diagnosis.
Of course, which I suppose is a bit of a double-edged thing, isn't it? Obviously, you want more people to come forward. You obviously don't want people to not be approaching yourselves because they need the help. As you say, it then does affect obviously those figures, but thankfully obviously more people are coming forward, and hopefully that will continue. So whilst we know obviously how common it is, what are the sort of symptoms that are the most common symptoms that people could experience?
So, like Andy said, we see people with stress incontinence, and that's something we see a lot. So stress incontinence is the leaking of urine with things like coughing, laughing, sneezing, or movement. So any time that there's kind of strain placed on the abdominal area, and then it causes a leak. And we also see urge incontinence. So that is more when someone gets the sudden urge to go for a wee that they then can't hold on to that, and that can lead to leaking as well. So they're two of the most common things that we see in terms of bladder symptoms. We also see a lot of pelvic organ prolapse, like Andy was saying, and pelvic organ prolapse is when one or more of your pelvic organs is not sitting where it should be, so it can descend slightly into the vagina, and that's what causes that kind of heavy dragging feeling that a lot of our patients experience. And then we also see the bowel side of things, which is fecal incontinence. So that's the leaking of fecal matter. And like Andy was saying, we also see a lot of incontinence of wind, which does cause a real source of embarrassment for people. I mean, all of it can be really horrible and embarrassing, but we do find that a lot of people find the bowel and the wind side of things a huge source of embarrassment.
Yeah, I can only imagine that.
Mm.
And especially as well, like you said, with the first two things, I wonder if people realise that actually, like you were saying, like the leakage of urine, the urgency of needing to go, whether people associate that as being something with the pelvic health, or whether people just assume that because you've had a baby, that's just what you sort of expect to happen, or whether people actually realise that is related to those muscles and those things
And that's a huge thing that we do we talk about in clinic, and we want to spread the awareness of that. Although it's so common, it's not normal. It's not classified as normal. We shouldn't normalize it, because it's common, but it's treatable, and we want to promote that just because you've had a baby, it doesn't have to be like that.
Yeah, and it's that thing, isn't it? As you say, like breaking down that stigma around talking about it and normalize talking about it, as opposed to normalizing the symptoms. Because although common, it's not how it should be, I suppose.
Yeah, and certainly in the pregnancy period, it's been fantastic the last couple of years, because we've had a real drive towards prevention. So the maternity staff, the midwives have certain times, especially the 16-week mark, where they ask special questions to try and see whether someone is more at risk of bladder and bowel issues, like whether there's a family history, whether they've had previous problems, and then they will advise them according to where they rate on a sort of severity score. So it's very much getting in there early rather than waiting for someone potentially to come to them, or to come to us, worst case scenario, with problems sort of 10 years after they've had their baby, trying to sort of nip it in the bud much more, and that's working really well.
Amazing, that's brilliant. So yeah, as you've just sort of touched it a little bit, but is there anybody who is more likely to experience problems with their pelvic health, or certain types of births that would impact that more?
Yeah, absolutely there are, and we tend to separate things into modifiable risk factors, which are things that you can do something about, and non-modifiable, which are things that either have already happened, or whether they're, for example, genetic factors that you aren't able to change. And we, as you can imagine, in our clinics, when we see people, we try and focus on the things that are modifiable and that they might be able to do something about, and we try and support them in any way that we can. So some of the main ones are things like lifestyle factors. So smoking is a risk factor, lack of exercise is a risk factor, constipation, so something which can be managed if you have the right tools and the right advice. And then we have things like pregnancy and childbirth, which of course I'm not saying that we want to do anything about, but it is a really key time where we can try and target women to get into good habits. So it's quite a key time. Then you have certain types of births, so ventouse or forceps birth, 3rd and 4th degree tears. Those are higher up there in the likelihood of experiencing problems. So again, if we can target those women early on, then we can give them the right advice to try and prevent any problems later on. BMI, so body mass index, your weight does play a part. And again, we try and be as helpful as we can, giving advice or how to refer on, conversations to have with your GP if you are struggling with that. And also weak pelvic floor muscles. So pelvic floor exercises are something that we very much focus on. I'm sure most people will know that. But again, as I said, healthy weight, exercising, managing any chronic constipation or cough, and then working very much with the maternity team. There are things that people can do during the course of their pregnancy, such as perineal massage, liaising with their midwife about the best positions in labour, and we have as well got resources and material to support that. So there are things that you can do to help.
Yeah, definitely. Thank you. So yeah, obviously, as you were just saying, like with the resources and stuff, that's what I was going to ask. So is there any like online resources that are available to people?
Yeah, so one of the main resources that we have available is via the LMNS, Sussex LMNS website. So we do encourage absolutely anyone, pregnancy and postnatal period, to go onto Sussex LMNS. And that is the website that is almost like a one-stop shop for pregnancy and postnatal. In terms of our specific resources from physiotherapy, we have our Wellbeing and Exercise in Pregnancy programme, and those are free online resources, a library of exercise videos, and then also information videos. So we call them spotlight ons, and they are topics that we so commonly get asked in clinic. So it's all of the information we have, hopefully packed into a couple of minutes of useful information. We also have FAQs, so frequently asked questions, and resources, and we are in the process of taking everything onto a brand new website with loads more information added, and that is a work in progress, which unfortunately I don't have the actual date yet, but it will be very soon. And so that will just be a seamless progression from where we are at the moment to something that is hopefully much more accessible and has more material. And throughout all of that, we also refer to our sort of pelvic health governing body, which is the POGP, and they have a number of free downloadable resources as well. So there is lots out there, and I think there's enough out there for people not to have to do random Googling and potentially finding information which
Definitely,
can be sometimes counterproductive and not accurate.
of course, and definitely, as you say, like especially with the website and things, that once your side of things is up and running and available, we'll add it into like the comments on this or whatever, so a link that people can follow over.
Yeah, brilliant. Thank you.
That sounds
We
good.
have
No
still
problem
got
at
our
all.
website at the moment, which people can use, you know, in the meantime, and there is loads of resources on there. I will come on to talk about that in a minute, actually. But yeah, that would be great if we could get that put in the link as well.
Yeah, absolutely. No problem at all. Thank you. So yeah, so how can people either be referred or self-refer to you?
So our preferred way of referral is via the LMNS website, purely because the way that you refer via there has all sort of the screening questions that we require, and it's kind of the way we get the most information before we meet the patient. But if anyone struggles with the form or can't access the form, then their midwife can refer them.
Brilliant. And just to obviously let people know that the LMNS stands for obviously local maternity and neonatal systems.
Yeah.
So yeah.
And the one thing I really would highlight as well is that I think sometimes people historically have thought that they maybe need to get their midwife or their GP to refer, but that's not the case, and it can be a lot quicker to do the self-referral, because you don't have to wait for that initial appointment to see them to refer to us. You can do that self-referral.
Of course. And like we said before as well, is it's then one less time that you've got to talk about your symptoms or go through it with somebody else. You can, as you say, you can just self-refer in your own time and then get that over. Then they can come to you, either yourselves, and speak to yourselves about it, rather than, as I say, GP and all of that and going round.
Exactly.
Absolutely. Yeah, and I think in general self-referral has worked really, really well, because again, that's something that we wouldn't necessarily have had like 5-10 years ago. So
Of course.
we're making progress.
It sounds great. So are there any classes that people can attend for advice on how to care for their pelvic health during their pregnancy?
Yeah, so we do have a antenatal physiotherapy class which goes through all of the basics of bladder and bowel care, pelvic floor exercises, perineal massage. So it really is something that we encourage everyone who is having a baby to attend. The classes are on Tuesday mornings, and you will be given the option to be referred by your midwife, usually at the 16-week mark again, but some midwives will ask you and refer you before, and certainly if you want to be referred before, you can be. And what we include in the class, as I said, is about bladder and bowel care, also risk factors we talk about perineal tears, and essentially look at prevention. So trying to ensure that those who don't have any symptoms at the moment continue not to have symptoms, and very importantly, know how to refer and what to do if they do start developing anything. If people are unable to make the class, we also have an online recording. So it is information that everyone should know.
Definitely. Yeah. If, for example, somebody couldn't attend the class and they did the recording, they did have questions that obviously, if you were able to attend the class, you'd be asking or talking about. Is there a way that people can ask those questions after they've watched the online version of it if they're not able to attend in person, or?
So we don't have a specific sort of online facility for that, but if anyone has attended the class and they feel they need further help, essentially they can just book in with us for a one-to-one. We are sort of available, so also if they contacted the department, we're able to sort of get back to them as well. But yeah, that is the advantage of being there. So if it's the odd question you have, it's actually quite nice to sort of be able to interrupt or to be able to ask those questions at the time. But yeah, absolutely. If there are any problems and they need us, then they can book in for a one-to-one and just say they've attended the class. And actually it makes the one-to-one appointment much more efficient because there's a baseline of information that they know. We don't need to go through it again, and we can spend much more time personalising the appointment and making sure that we're getting to the root of their problem.
Yeah, of course. Thank you. So, do you have a social media account that people could look at? And if so, what could they expect to see on there? For example, like practical tips, videos, what sort of thing? I know you said about you've got a social media account and that's what you do. What sort of things
So
are on there?
that's my area.
That's your bit.
Yeah, so we have got we're relatively new on social media, to be honest. We are at Sussex Web at the moment. We are, like Andy said, with the website and everything, we are going to relaunch, but that won't affect our following at the moment. So we are at Sussex Web, and we post twice a week, and we post a mixture of things really. We tend to have a monthly challenge, which is something that so at the moment it's a hydration challenge, so trying to aim to drink enough of the correct fluids, whether you're pregnant or in the postnatal period. So we try and make it inclusive for pregnant and postnatal, but we do health related and well-being challenges, and we also post just tips really as well about things that people might not know about the pregnancy or postnatal period, and just things that are just useful really to know in that time really. So we post twice a week. We post a mixture of reels and sort of just templates, and please come and follow us.
Amazing. It sounds great. So would you happen to have a take-home message for our listeners today, or anything, any sort of little tips and tricks that you can think of that you think it'd be useful for them to know?
Yes, so I think we've kind of touched upon it throughout the whole of this chat really, but just about pelvic floor really, and the importance of pelvic floor exercises, and like Andy was saying with that prevention side of things, is that everyone should be doing their pelvic floor exercises really, to prevent some of the things that we've spoken about today. So pelvic floor exercises, I'll just quickly run through how we explain them and how we teach them, if that's okay. So your pelvic floor muscles sit underneath your pelvis, and they work to hold up your pelvic organs and keep them nicely in place, and they also control your continence. So the way that we teach you to do your pelvic floor exercises is to start in a seated position, and I imagine that anyone that's watching this would probably be in a seated position.
Yeah.
So when you're in a seated position, you need to squeeze in around your back passage like you're stopping yourself from passing wind, but at the same time squeeze in around the front like you're stopping yourself going for a wee at the same time. And you should feel it, if you're sat down, a little bit of a lift from the chair, and that's a good indicator that you're working those right muscles. You want to try and keep your tummy muscles and your bottom or your glute muscles relaxed, and breathe normally throughout. So you do that squeeze in through the back passage and the vagina at the same time, and you want to hold. So we do a mixture. There's different types of muscles within the pelvic floor. There's your long hold muscles and there's your quick, short, sharp muscles. So you want to do a mixture of long squeezes and short squeezes. The recommendation is that you do a 10-second hold, and you do that 10 times, followed by 10 fast squeezes, and that you do that 3 times a day. That sounds like quite a lot, but it's really not. You know, you can be sat and doing it and no one knows that you're doing it.
Yeah.
But because they're such little muscles, really, they have, you know, you have, it's more that little and often that you have to do them. So our take-home message would be to do your pelvic floor exercises. Anyone and everyone should be doing their pelvic floor.
Yeah, and also when you're starting off, you know, don't be alarmed with a 10-second hold, because you start off with whatever your starting point is. So we sort of say to work from 3-4 seconds and then to build that up gradually. And hopefully as the months progress, you'll get nearer to that goal. Yeah, and then once you can do that in sitting, then you can progress to standing and sort of more functional movements, to make things slightly harder for you and to continue to challenge those muscles.
Yeah, and I remember you saying before about how like linking it to something that you do, like a habit, to sort of remind yourself to do those couple of times a day, whether that's your morning coffee or a certain feed time of day, or bath time, or whatever it may be, just to try to create that, so you do remember it and you do fit it into your day.
Yeah, and there are a number of apps out there. One is there's the NHS Squeezy app, for example. There are other ones out there. There are so many that we can't possibly sort of validate them all.
Of course.
But often the principles are the same, that it's giving you those alerts. And once you know how long you are able to hold, that's the important thing, because you don't necessarily want to follow an app that's telling you to do what is not at your level at the moment.
Of course.
Yeah, and again, if in doubt, if you're not sure whether you're doing things right, then you know, come and see us. There are ways in which you can check as well. So you can just rest your couple of fingers on the perineum. So that's the area between the front and the back passage, and you want to sort of feel things drawing inwards. Or if you're comfortable, insert clean finger or thumb into the vagina and feeling for the squeeze of the muscle, and very importantly the let go, because that's what sometimes happens. People don't get a definite squeeze and a let go, and everything blurs into one. So we just want to make sure that you've got the hang of that.
Brilliant, thank you so much. I really appreciate it, and hopefully this has obviously been much clearer. People will be able to hear all of the information and put that to good use. I really hope.
Yeah, brilliant.
Oh, well, thank you for having us.
Thank you so
Alex.
much. Thanks.
Thank you.
See you
Bye.
soon.
Bye.
Bye.
Bye.